The question is that the House do now adjourn, and I give the call to the member for Bean.
Speaker, please also accept my belated congratulations. It's disappointing to lose someone who was basically a neighbour, but well done.
Thank you.
Speaker, tonight I'd like to take this opportunity to raise the issue of neuroendocrine tumours, also known as NETs in Australia. The issue was brought to my attention in a meeting with Canberrans Lynda and Simon Dunstone, who are working to raise awareness of NETs across the ACT and across the country. Lynda has a stage 4 pancreatic NET that has spread to her liver. She was misdiagnosed and had 2 years of chemotherapy for the wrong cancer before finally getting her diagnosis. This was in addition to a lengthier original misdiagnosis. Heavily impacted by her misdiagnosis, Lynda and Simon have been working with the not-for-profit Neuroendocrine Cancer Australia, advocating for greater awareness and policy change regarding NETs. Lynda is also a valued support group facilitator for other patients. NETs are a distinct type of cancer. They develop from the endocrine system rather than cells from an organ or tissue like other cancers. They can arise in various parts of the body and can also develop into other conditions such as diabetes and other diseases. Sometimes it's referred to as the forgotten cancer, as there's a concerning lack of awareness of NETs by both healthcare professionals, let alone the general community. This means that patients are frequently misdiagnosed or only diagnosed after significant delay. Indeed, Speaker, the median time to diagnosis is 9.2 years, and in 60% of cases, the patient has stage 4 cancer at the time of their diagnosis. This not only has a severe impact on patient survival and their quality of life. They face high out-of-pocket costs, reduced capacity to work, if not early retirement, and financial stress. The emotional health of the patient, their family and friends are also substantial. Furthermore, late diagnosis results in high economic costs to the health system due to unnecessary and inefficient use of healthcare resources. Sadly, Speaker, the number of sufferers of this debilitating condition is high. There are currently more than 22,000 Australians living with NETs, and over 5,000 people are estimated to be diagnosed this year alone. This year it's estimated to be the 7th most common cancer diagnosis, yet it's still relatively unrecognised in the general community. Nonetheless, compared to other countries, Australia plays a leading role in significant areas of research and many therapeutic treatments for NETs. However, patients remain far from receiving optimal treatment. We must do more. Neuroendocrine Cancer Australia have pioneered a national action plan. The goal of the plan is to highlight the need for the greater awareness of NETs as a distinct group of cancers and a significant impact on patients, their families and the healthcare system. The plan is built on over a decade of research working with patients and other stakeholders. Some of the recommendations, Speaker, include increased patient support through specialist NET tele-health nurses. Currently, there is only one NET nurse for tele-health purposes for over 22,000 patients across Australia. There's also a need for targeted awareness campaigns, healthcare professional education, nationwide optimal care pathways and referral frameworks, and health sector delivery support through centres of excellence and a NET data registry, as well as, of course, increased access to research funding. Central to the plan's recommendations is to leverage existing capabilities, expertise and infrastructure. Now, Lynda and Simon reached out to the federal government seeking consideration of the National Action Plan's modest recommendations. However, they were not reassured by the government's response. NETs, as a distinct type of cancer and its place within the existing structures, were overlooked. And the funding figures noted in the response were inconsistent and added confusion. The modest call for an additional 5 telehealth NET nurses was rebuffed, despite the capacity of a still small team to provide invaluable advice and referrals to those 22,000 patients. But I'm pleased to say, Speaker, that the Shadow Minister for Health and Dr Mike Freelander and other medical professionals here are actively engaged in trying to raise awareness on these very serious issues.
The question is that the House do now adjourn.